absolutely thrilled to be partnering with a whole group of MPs to produce this paper, Community Covenants, looking at a new approach to public service reform. My name's Polly Curtis. I'm the Chief Executive at the think tank Demos. And we've got the most brilliant panel here to share some of the ideas in the paper, give a government response to what's in the paper, and explore the ideas about what the Conservative case and approach for public service reform should be now. So I'm delighted to welcome from left to right, Danny Kruger, MP for Devizes, Jerome Mayhew, MP for Broadland and Fakenham, and Neil O'Brien, Minister for Primary Care and Public Health, which is, of course, an incredibly important brief within public service reform, and Juliet Samuel, columnist at the Daily Telegraph. Oh God, I'm so sorry. So sorry. Now I feel like I have to pick a team, and so the Times is even better. Thanks so much for joining us. So I also want to just do a quick welcome for the audience outside of the room. We are live streaming this on YouTube, where people can also leave comments and questions for the audience participation bit later on. So welcome everyone not in Manchester at the moment. I nearly said Birmingham.
It's all going very well.
It's all going very well. I'm going to start by asking Jerome to give his thoughts on the key points in this paper and what it means for the Conservative approach to public service reform.
Brilliant. Well, thank you very much, Polly. First of all, I'm going to say thank you to Demos for giving us the opportunity with the new social covenant to help to create this pamphlet. I think it's a really important document that helps describe the change in thinking that we need as a Conservative Party to approach public services, because we've got a history of public services since the Second World War, which has failed. It's been essentially reactive. If you think of the way the NHS is set up, it's you have an illness, you go to your doctor, they patch you up, and then they send you back again. They don't treat the underlying social causes, perhaps, of the reason why you get the illness in the first place. If you have, if you're come into contact with social services over child protection, it intervenes when there's a concern about a risk to a child. It doesn't start with the circumstance around which that child is living and the family cohesiveness of that relationship. And the result of this is that we've had reactive approaches to problems which society has thrown up, both physical and societal itself. And we have demand limited essentially by rationing. That has been the experience to a greater or lesser extent of the provision of public services since the Second World War. And whereas in the founding fathers of the National Health Service imagined that demand would fall off as the national health improved, we all know that the lived experience has been the exact opposite. And we're now in this extraordinary position where the single biggest fiscal outlay for our country, for the Chancellor, some £300 billion every year is spent on social protection. Essentially, that's supporting the vulnerable in society. £300 billion. Why has this become a growing problem as we've become richer as a nation? We are more healthy now. We are better educated now. We live in houses which don't leak, are warmer, have central heating, have indoor loos. All the things you can measure objectively about quality of life have improved enormously, even in my lifetime. And yet, demand need has gone in exactly the opposite direction. And the question is, why? Why has that happened? And this paper starts to answer that question, because, in my view, we have outsourced our civic responsibility to the state. We've said, as a taxpayer, I can pay my taxes, and then the ills and others of society are no longer my problem. I paid for someone else to take that responsibility. My civic engagement has been absolved by the writing of a check. And if you have societies which are built like that, which are individualistic, then you lose the social resilience that comes from the interconnection of communities, all the network, the cobweb of connections between members of community then you become much more vulnerable as individuals. And we can see this in our recent history. Just look at the impact of the pandemic on communities across this country. We can see in the response to the pandemic that those communities which retained social cohesion, that had a rich interconnection between individuals, they were much more socially resilient to the pandemic than those which have been stripped out through over-reliance perhaps on the state. And so I think you've got to say, well, where does this resilience come from? How do we bring it back? Now, the first community that we all live in is, of course, that of our family. I'm not lecturing you, that's not our role, I don't think, of what a family should look like. Families come in all different shapes and sizes. But there is absolute interest in the state to focus on the cohesion of family, how children are brought up. The evidence on this is absolutely overwhelming, going back to the Marmot Review and before, back in 2010, Fair Society and Healthy Lives. The import of the role of family in protecting the next generation from social harms and physical harms is overwhelming. So why is it that we have reduced our state spending and focus as a percentage of GDP on the family over the last 10 years, really quite significantly? We've about halved it. Why is it that the David Cameron era, the family test, which was something which every department was meant to look at, the lens through which departments meant to look at their policies and say, well, what impact will this have on the family? What's happened to that? Why isn't that at the forefront of policy making any longer? And let's look at our tax situation. Are we supporting families through the tax environment or not? Could there be tax flexibility for family groups? And that's not just Christian marriage. I'm talking about families in a much more inclusive and wider context. Can we complement the very impressive developments we made in childcare provision up to 30 hours a week? Is there something more that we can do for families which perhaps don't want to go into childcare, want to keep the family unit more closely knit? It's a choice. So that's the family. There's a lot of ideas in this pamphlet on how we can support families as the knit unit of social cohesion. And then if you take the next step out, you go to community. We've had the Levelling Up white paper, which talks about creating pilots for community governance. Well, we need to take that next step and make them happen. And the timing of this report, it could not be better, because there was the announcement just yesterday of the long-term plan for towns, which had many of the concepts which we're talking about in this pamphlet writ large in that £1 billion project, which for those of you who haven't read it yet, it's Michael Gove has chosen, based on social deprivation, 55 towns and has granted each of them an endowment fund of £20 million. Well, government spends money on towns isn't the headline. It's how that money is then looked after and spent is really innovative, because the intention is not just to give it to the local authority, but to say, no, we're bypassing the local authority and going straight to the community, where the community groups, in consultation and in partnership with local authority and with the local representatives like excellent MPs like Danny here, that they come up with their own solutions to what their own problems are. So the gentleman from Whitehall deliberately is not knowing best. Who knows best the unique challenges of a community than the community itself? And giving them the power and also the finances, having a community covenant in a sense for those towns is exactly what this pamphlet is talking about. So I think you've got some really strong ties where we're building on the conservative philosophical concept of community. That we are not, of course we're individuals, but we live in a community, and that's the difference between a conservative and a liberal. That we believe in community, we believe in supporting each other through the family, through the village or the town, and then the nation. This fits very, very neatly within that core conservative philosophy. And it's because of that this pamphlet has received support and input from members of our party who are on every and all spectrum of the left-right broad church, which we're lucky enough to call the Conservative Party. So it's an inclusive approach based on the fundamental concepts of what it is to be a conservative. It brings power down to communities at the most fundamental level, supported from failure by the involvement of local authorities, to help with governance, to help with the nuts and bolts of how you do it. But you're giving power and accountability down to the lowest level of society, consistent with the decision that we're asking them to make. I think that is a very, very exciting policy agenda, one that Labour will not follow us on, because they fundamentally do not trust people. They trust the state. They see community, they confuse community with the power of the state. Whereas we, as Conservatives, we trust community, we support community, we trust people, and we're prepared to back it with our policies.
Okay.
Thank you so much. Danny, what's left for you?
Okay, thanks very much, Paul. Thanks, Polly. And my thanks also to Demos, been a great champion of this agenda over many years, and really pleased to have been able to partner with them. I really want to just honour what Jerome, or Jermone, as we call him, on the front of the pamphlet, is saying there, because it's him. He says it in a very gentle and sort of respectable conservative way, but actually that's a very radical agenda that he's articulating. I mean, it's a very traditional one, so I like it, but it's very radical. There's a huge agenda of reform implicit in what he's saying and what we're saying in this paper, and I'm encouraged that so many colleagues have signed up. I'm encouraged, as Jerome says, that we are echoing what government is now announcing. I thought there was tremendous news about this new endowment for towns. It echoes the government's decision to endow a new community wealth fund. Margaret's here from Local Trust, which has led the campaigning on that. The principle of capital being put under communities and trusting local people to decide how that money should be spent for the long-term good of their community, without it being filtered through the silos of Whitehall and of different government departments, allowing proper bottom-up pooling of resources for investment in prevention and in the often quite bespoke and frankly eccentric sorts of funding that actually goes to the heart of social challenges in local places. Great news that government is recognising the necessity of that approach and is standing up to the old orthodoxy. So what we see, and I think Jeremy mentioned it in his speech today, is a new focus on public service reform, which was the great theme of the Cameron years in government and was going to be the great focus of David Cameron's attention if he'd won the referendum. And of course, we've been distracted in our politics for 8 years. And while I supported Brexit and really believe in what we're doing now, I actually think that cry for taking back control that people expressed in that referendum and then again in 2019 applies just as much to the demand to take back control of local life as it does for national life. I think people are hungry for agency and belonging at a local level. So how do we go about the public service reform agenda, which I hope is now back on the government's radar? And what the paper sets out, I think, is a really helpful framework for thinking about that, rather than what might be thought of as a traditional public service reform approach, which of course has been tried by Conservative governments as well as Labour, which is to design the system you want from above and then try and implement it through legislation, regulation, directives to officials and civil servants on the ground. The better approach is to set the framework in which communities can take more responsibility and frontline professionals themselves can take more responsibility and enable the emergence of challenger models, challenger institutions to the status quo. And the community covenant principle, which was set out in the Levelling Up white paper, in fact, when Neil was in Michael Gove's team at Levelling Up, and the Levelling Up white paper put across the principle that communities should be allowed to develop their own approaches to public services in the broadest sense. So it might not be confined to a specific Whitehall department. In fact, explicitly, its value is it's not, it cuts across. But that communities should have the power to originate policy initiatives and policy design at a local level. And the New Social Government Unit has done some research, including in Jerome's constituency and elsewhere, of the sorts of models that people would like to see, and that work's going to be published in the weeks ahead. But what I like about what we're saying here, and what I urge to colleagues to reflect on, is the opportunity actually to return. I mean, because I'm a conservative, I always put this think about how we can return. And what I'd like to return to, obviously not to the actual model and not turn the back in a single moment, but actually to the principles of the foundations of our public services, which is not in the Attlee Settlement post-war years. It was earlier in the Victorian principles of self-help, community reliance, and mutuality, out of which emerged the local institutions which were subsequently, for good or ill, with positives and negatives around it, nationalised by government. And actually, so many of our public services have their root in community responsibility and in local power. And I've done a lot of work in prisons and probation. The probation system grew out of the police courts, the London police courts mission, and it was people coming along and saying we can help rehabilitate offenders and prevent recidivism. That is the spirit in which I think we can rebuild our public sector from the ground up by empowering communities to take back control and take responsibility. And the job of government is to set a framework in which that is possible. And that's the way to reform public services, from without and from below, rather than from above and through the hierarchy.
Thank you so much. Thank you. Neil, there's a case there not just for investing in communities, but trusting and devolving power to communities to reform public services. And how do you respond?
So I think there's a huge amount of overlap between the agenda that is sketched out here and the agenda that we are pursuing in the Department of Health. I would say that our agenda in terms of patients is in terms of getting towards a true health system rather than a hospital system. So swinging the system around so it's much more preventative, making it hassle-free for patients, and empowering people to take charge of their own health. And then on the other side of the ledger, for clinicians, our agenda is about building on their freedom, giving them more control, but at the same time improving accountability. And just to give you a couple of examples of what that means in practice. So in terms of a hassle-free preventative system, so the first step obviously is to make sure you can get through to your GP in a timely way. Hence the primary care recovery plan, hence the extra 27% increase in the number of staff in primary care, hence the £240 million investment where we're making in new technology, so proper phone systems, so you never get an engaged tone when you ring your GP, up-to-date triage and digital systems so that it isn't just about ringing up, but we keep the phones free for those who want to use them by allowing everyone else to do what they do where they interact with any other modern business and be able to interact online and post their symptoms and post pictures too, so they can get timely treatment. It's about making things hassle-free by creating a new NHS service, Pharmacy First, launches this winter, where you'll be able to get treatment from this winter for a number of common conditions, not by going to your GP, but going to your pharmacist who will be able to give antibiotics where appropriate, building on all the skills that those people have got. In some ways, also returning to some of the earlier years of the NHS by building on our community hospitals, our cottage hospital sites, and indeed getting care into the high street through our community diagnostic centres. We've started this programme about 2 years ago, built 119 of these things. We've seen about 5 million people for potentially life-saving diagnostic tests. So a huge and rapidly moving programme that is again bringing care closer to people in their own communities, and we're of course building on that. So we are also rolling out a lot more blood pressure checks in people's pharmacists. So you pop in to get some shampoo, you can get a blood pressure check that might save your life. Trying to bring it into employers and into the community as well, and to lean into social trends as well. So we are using growing interest in health apps and the fact that everyone's now got a smartphone in their pocket in experiments like the one we're doing in Wolverhampton, where we've given a huge number of people what is effectively kind of Fitbit and an app. It lets you track the exercise you're doing. It lets you monitor what you're eating. It also has some rewards attached to it in terms of giving people an incentive. And an incredibly high proportion of people in Wolverhampton are now using this very exciting system. So it's a preventative system for the patient. It's a hassle-free system that's easy to use. And then for the clinician, we're trying to build on the freedom that is there for clinicians. So, and there's a really clear choice there. So Wes Streeting talked about making all GPs state employees. This is going back to a policy that even Nye Bevan abandoned I think it's completely the wrong way to go. I think it's striking that the most European part of our health system, the GPs, which are effectively 6,400 different small private businesses, are in many ways the most dynamic. They're the best liked part of the NHS. The IT in general practice is 30 years ahead of where it is in hospitals because they have freedom. They can go out and pay. They can, they can paddle their own canoe. If you want to build a building, you can go out and borrow money and build it, right? You don't have to wait for the minister's approval. And so we want to build on that freedom. And so that is why we are cutting bureaucracy between secondary and primary care. We are getting rid of the endless flows of paper that make GPs' lives a misery. We are making it so that you can see each other's records without having to ring each other up. We are making sure there's always a phone line so the GP can get through to the hospital doctor. We're getting rid of the targetology, cutting back the bureaucracy of things like IIF and the QOF, which became so overblown during the Labour years, freeing up their own budgets for staff. And that is something we're doing across the health system. So, for example, in pharmacy, you have all these, again, dynamic private businesses that are part of the NHS, provide NHS services. And we've tied them up in red tape where you have to spend lots of time as a highly qualified pharmacist snipping up little packets of pills to dispense exactly the right number. You can't hand out a bag of medicine even if it's all prepared if the pharmacist is not there. This is total madhouse stuff. We need to empower these people to do more. And then on the other side of the ledger, we need to have accountability, right? So I, every month, get data on how well each ICB, how each part of the country is doing in terms of dentistry. And it is not published, and that is wrong, right? So we are going to publish it very, very soon. We have, while I've been a minister, created a system on a website called Fingertips so that you can all go and see how your GP practice compares on a whole bunch of indicators to all the other ones around it. If you want to change GP, it might enable you to make a decision on that sensibly, and how it compares to the rest of the country. And the same is true at the level of the leadership. We want to have a lot more accountability for failure and for unnecessary variation at the top level, including for places like Manchester that have health devolution. But that, in a sense, is a core health agenda. But there is a wider agenda, which I think NCSU's work has been so refreshing and so helpful in widening out the conversation a bit and opening up some conversations that had been shut down. So I think, for example, in health, we talk a lot about the social determinants of health. It's hugely powerful. The performance of the health system is only part of what drives people's health. There's a lot about our culture and society that are incredibly powerful in that. But we could talk more generally about the social determinants of the public services. And that brings us to some of the issues that are raised here and raised more generally through the work of Danny and others. So, for example, I really welcome the return of the discussion about family policy, which was so current under David Cameron, and for lots of different reasons has really slipped off the agenda. I'm not here to lecture people, tell them to have to live their lives. It's impossible for us to do that. But if the government does use the tools it has in ways that will make it marginally easier for families, make it slightly easier for people to bring up kids, and this isn't the easiest country in the world to do that, then the potential rewards of that, or to even marginally encourage family stability, the potential benefits from that, even if you are the most libertarian person in the world, just to the taxpayer, just in terms of the burden that it takes off of the state, are so powerful that we cannot afford not to try. And likewise, in terms of the social fabric, now, my constituency is on the edge of Leicester. You do not need to talk to me about the contribution that immigration makes to this country. Lots of my constituents have come here, some of them in the case of the Ugandan Asians fleeing for their lives with nothing but their clothes on their backs, and made huge contributions. But over the last 2 years, net migration has been something in the order of, after you discount the people who've left, something about 1.1 million people in just 2 years. And you don't have to be a super immigration skeptic to think that that is too high. I can see the effect of that in terms of the housing pressures in my own local area. If you think that we built over the last 50 years roughly about 250,000 homes a year, we have a really serious housing problem in this country. We will not get even to first base of solving the housing crisis if they continue to run at those kind of numbers. Now, I am proud that we did Homes for Ukraine. I had refugees living in my house around our kitchen table, right? It was the right thing. As someone who is banned from going into the Republic of China because of our work with the China Research Group, I'm proud that we took in people with British passports in Hong Kong. Overall, there is no question that we will not be able to tackle some of the challenges for housing or public services, or indeed the social fabric, if we have too transient society, if the flows are just too big to have meaningful integration. So we had to have control of immigration in order to have integration and to solve some of those challenges for our public services. So I wish NCSU and DDEM as well, in widening out the public discussion. So it's not just about, in a sense, public sector reform in a narrow sense, but also the other kinds of reforms, the other kind of subjects that in the Cameron era we were so seized of the need to do things on. And I welcome the return of those conversations. So I pay tribute to Danny and others involved in the NCSU and Jamone as well. Thank you for your contributions here.
I cannot.
This is your terrible. This is the worst ever fake ID. I think we busted you straight away. But I thank you for your work, and I thank you for hosting us today, and I really look forward to the discussion. Thank you.
Thank you. Juliet, can you give us a kind of reality check on the political messaging around this? The Conservative idea of investing in communities to strengthen outcomes and prevent problems from coming up. How will that sell politically?
Well, I think probably the general message that people have about Conservatives and public services at the moment is frankly austerity. And I think that's one of the problems that really any government will have, actually, whether Conservative or Labour, is that we are inevitably in an age of austerity because the economy has not grown sufficiently. We are not competitive enough, and we do not have enough wealth to sufficiently fund all the services that we want. And you can raise taxes, but in the end, that reality is just an intractable one at the moment. And so, and it's actually interesting that even if you go all the way back to the beverage reports and the implementation of it, there was extraordinarily little thinking devoted to how you were actually going to pay for this. And the only way you can pay for it is if your economy is competitive enough to generate the wealth to pay for it. And so one danger, I think, of Conservatives talking about delivering public services differently is that people take that as, oh, that's code for another kind of austerity. And so I think, especially if you're talking about communities doing more for themselves, you have to be very careful, clear, or plan it well so that that doesn't just mean to them social care cuts, which councils have had to absorb huge amounts of, or planning departments just failing to be run properly because there isn't the funding or the wherewithal to do it. So I think that's the first challenge. I think the second aspect is this agenda, I think, actually on this front could be very positive, which is that the only way you're really going to improve public services is through innovation and productivity improvements in public services. A lot of the stuff Neil was talking about is some of how you get there, but you also need more experimentation and the ability to fail and to do things differently. And some of the stuff Dan talked about with new forms of community coming together to do things could deliver that. But part of the reason why we don't have that in a lot of the public sector is that there's huge punishment for failure, and there's an obsession with the postcode lottery and fairness. And in some ways, the more accountability and transparency you have, the more you have that problem, because you can see very clearly where a community has tried something and it hasn't worked. So I think you have to work out how you allow for failure without having just moral hazard. And then the third thing is broadly, I think that this is in some ways hugely ambitious, because ultimately it's about people living their lives differently, living more in their community and in their family, looking after their parents or their grandchildren or their nieces and nephews. If you want people to live differently, then actually policy is not really the most powerful tool. And you need a different economy, a different culture. Migration, I guess, is part of that in terms of cultural change, but also technology and how you handle technology, who uses it and how it's used. So, and you can have tax incentives. I think it's crazy that the tax system punishes family formation, but it's only going to take you so far. in terms of cultural change. Again, you can change the economy. I think, there needs to be huge change to how we manage the economy in terms of industrial policy and competitiveness. But again, until that happens, until you don't have people moving away for university and then moving to London or to some other hub for their job, and then having to move again to form a family, you're not going to get the structures you need to build these kinds of communities. So I think those are the main points I see.
Thank you so much. And immediately provided 3 questions that I'd like to put back to our colleagues. So Jerome, will you come back on the point about code for austerity? Neil, I'm going to come to you on fear of failure, but also the funding for this, because a lot of this is going to be longer term, less certain outcomes, especially when we're thinking about prevention. How do we make the space for a different way of thinking of investing in communities? And then Danny, I thought the question around policy versus culture, is this about policy change or culture change?
I'm so glad you gave me that question because the other ones are really difficult. You're absolutely right. This could be characterized as a code for austerity. Of course it can. And Danny made reference to one of the workshops. There were 3 workshops that have been undertaken, one in Peterborough, one in Newcastle, and another one in Elsham, which is in my constituency. And I took part in that. And there is nervousness amongst the local politicians who are not blue, that this is another word for a retreat from the state. So this is a very live issue. The answer, of course, is that you don't impose this on anyone. Because it's bottom up, it is voluntary. So this only works if a community comes together and says, yeah, we see this and we like it, we want to take part. So it's not austerity being imposed, it's freedom being given and then received and run with. And we've got an exemplar in the new schools network, haven't we, with free schools, a challenger brand that Danny also mentioned, that you create through this network and examples of success, exemplars which other communities can look at and say, well, look, we're a bit nervous about this, but has it worked elsewhere? Yeah, okay, it has worked elsewhere. We've got the support of a new school, rather like the new schools network, we should have a new social covenant network that supports new communities who wish to get involved, a bit like the free school movement. And you can see and learn from other people's experience. And we've already, in a funny kind of way, we've already got evidence where this has worked with the Wigan town deal, which some of you will be familiar with. It's Wigan, over a decade ago now, did a version of a social covenant with its community, primarily focused around health. And during that period, the King's Fund has established that the life expectancy has gone up in Wigan, bucking a regional trend in the other direction, and that the quality of social care has improved significantly during the same time as saving £115 million. So being value for money is not code for austerity. It's what we should all be doing with taxpayers' money. Doing things better, demonstrably better, for less is the key that will unlock everything. And then if I can just come back onto, I'm cheating a bit, but I really want to come back on what Neil O'Brien said, which was he's describing lots of really good ideas about how you improve productivity in the health service. And I've got a pet subject which is dear to his heart, which is about dentistry, particularly dentistry in East Anglia. It's great that you have services which are designed and implemented in a more local fashion. But what we're collectively arguing is, why don't we go a step further and ask Norfolk, in my case, how they want their services delivered. Do they want to focus more on dentistry because the local need is greatest than on other aspects of primary care? And if so, why don't you trust them? Why don't you say, okay, we're going to work with you to design the dentistry provision or the pharmacy provision, or whatever aspect of the increased productivity with the community, then you're getting a double hit at productivity growth.
Just coming back on that, and each of those examples you mentioned, free schools, a new social covenant network in Wigan, actually take partnership with the authorities.
Yeah.
It's not entirely so it's not the state disappearing.
No. If I've given that impression, I mean, please read this. It's much better in the pamphlet than any way I can describe it. The local authorities are engaged as part of this. They're one of the partnerships. So you have a partnership of local authorities, you've got a partnership of primary care, so social services, you've got a partnership of faith groups. We had in the Elsham workshop that I was involved in, there were 8 or 10 different community organisations, including the local authority and the local primary care. So the local GP surgery was there, as well as the local NHS and the local vicar of the parish church. And you get a flavour. You get everyone who's engaged and really integrated in that community, coming together collectively to design. It's not saying it's one or the other. It's getting the ideas coming up from below.
Thank you. Neil, so coming back on the fear of failure and investing longer term, what can we do about that?
Yeah. So I don't think that the fear of failure is the main thing that stops innovation in health in particular. So I think the two challenges are firstly to fund and to get the innovation going in the first place, and then secondly to spread it. And this is probably the bigger part of the challenge. So in terms of innovation, we are absolutely doing everything we can to get the NHS to be better at adopting new innovations in the first place. So for example, there's an amazing multi-cancer, 50-cancer blood test called Gallieri, which we have said we will buy 1 million of, assuming it passes certain tests in the near future. We are rolling out an amazing set of technologies in terms of reducing HIV transmission through both home testing and also the amazing opt-out testing that we're doing in the emergency departments in places like Manchester and London, which is finding hundreds of people who don't know they have HIV. That's something we're keen to do more of. We're funding things like Brainomics, which is using AI to give you much quicker, much better diagnosis of stroke and hugely improve survival. But the key in the NHS really is actually normally the problem is replicating and scaling up innovation. So for example, I have already benefited from lots of local innovation. So in smoking, there was a scheme here in Manchester to give people £400 if ladies stopped smoking in pregnancy. Big success. We're replicating it nationally. There's a bunch of local authorities and housing associations who gave free vapes to smokers. Huge success. We're replicating it nationally. We're sending 1 million vapes to current smokers, swap to stop. Lung health checks, piloted here in Manchester. Take a bus with a screening device on it to the poorest areas. We are now doing that. The poorest areas, current and former smokers. It is inverting health inequalities. We are getting from 1/4 of cancers detected at the early, most treatable stage to 3/4 by targeting those areas. So we are able to pick up some of these innovations and spread them. That is a key thing. The NHS is always doing interesting things. The question is, do people water the plant and help it to grow? That is what we're trying to do, and also to build on the local, to build on what is proved locally and then scale it.
Thank you. So Danny, policy versus culture change.
Okay, thanks. Well, that's true, and I've just echoed Jerome's point about the voluntarism at the heart of this. It's got to be bottom up, owned by people, otherwise it won't work. That's the whole ethic of what we're proposing, and it can't be top down. The one thing that's not in our pamphlet, my new book, that I would recommend, and I do it slightly tongue-in-cheek, though I'm actually serious, everyone laughs, but the one thing that I would impose and make compulsory is council service. I think everybody should be, like you have to serve in a jury at some point in your career, everyone should have spend a term as a councillor. And what the transformation that could achieve both for councils themselves, but also for the wider civic realm, I think is great. But I say that because actually I think people would respond well to being invited to take part. And the point about culture change, probably, is I think what I'm thinking is getting at here is actually completely with the grain of the time, with the grain of the culture that's emerging. What people want, what they've actually always wanted, but increasingly now, as modernity does its work on us, and as actually technology enables this kind of life, they want a more local, more rooted, more connected life, where they see their family, they play a role in their community. They can be fully part of the global economy as well, but they want to be rooted and settled. And the model that we're putting out here, which invites people to take up the responsibilities of citizenship, not necessarily through formal politics, although I think, as I say, I think that should be something that the citizen does in the normal course of things, not just voting once every 5 years, 4 years. But whether it is through your local council or through playing a role, as many people do, of course. I mean, the great problem with the big society wasn't just that it was seen as a cover for cuts, it was as if David Cameron had invented the idea of people being good neighbours. And people took offence at that because, of course, many people play a very active role in their communities. But rather, as we've been discussing around family and policy, we think that most people want to settle down with one person and raise their kids together. Actually, that's with the grain of human nature. We should be reinforcing it and supporting it, honouring it. We should do the same about people's aspiration to be good neighbours and to play a role in the decision making that affects them in their communities. So yes, it is about culture. Julie's absolutely right. Policy is a teacher like the law. Incentives matter, and it is possible to, I think, have tweaks on the tiller that will help change the direction of our society. But fundamentally, this is about culture change. It is about the work that we all do, frankly, in our private spheres, in the conversations we have, that happens in the media. Not just through legislation, but it's all part of one big change that I think is underway. I think the great movement towards localism, towards the slow and organic, the relational, the hipster tendency, is a very positive and very conservative one.
Thank you. I'd love to bring some contributions from the audience. So if you have things to say, I'm going to go to these two here, and then I'll take two on the left, please. Charlotte and Seth.
I said I was working for Access and Foundation for Social Investment, and it's great to hear the debate about public service reform coming back into our politics. It's been absent for too long, and obviously Jerome talks about the community organisations in Aylsham. A lot of those will be charities and social enterprises who are the vehicles through which a lot of this bottom-up activism can happen. But they require money, and the way in which money flows to those organisations is often the barrier. It's not that they have the ideas, they know how to run services that result in that preventative outcome and keep people out of acute need, but they need to be financed because obviously you have to pay preventative outcome while you're still paying for acute care elsewhere. And there's a lot of capital that wants to come into that market to meet that need. But the mechanics of commissioning, I mean, the boring bit that sits behind, how does the money actually flow to these organisations? What do the contracts look like? Has always been the bit that's held us back. And I wonder, the principles are absolutely right, but how do we also then get the NHS and local authorities and public sector commissioners to be enabling the flow of money to actually live up to these principles? Because without that, I fear it would be very difficult to enact.
Thank you. Can you pass back to Charlotte? Thank you.
Hello, Charlotte Aldrich, Chief Executive of the Centre for Progressive Policy. It's wonderful to hear both the passion that Danny and Jerome have for the idea of community power, and similarly, it's great to hear Neil talk about the reforms that he's pushing through to increase access to quality primary care. However, I just wonder, as much as Neil, I think, can endorse and welcome sincerely the recommendations put by Danny and Jerome, I just wonder whether there's a gulf that sits between the two positions, partly for reasons that your journalist, I forget your name, apologies, set out about risk and experimentation and the like. I wonder how, if we are dealing with systems and the state, we can bring in community power to be a fundamental part of public service reform, or whether it inherently risks being marginalised and nice to have, and will consult community or tell them the devolving power, but really the way that players and how community operate is never going to change the world.
Brilliant question. Thank you very much. Danny, do you want to take that?
Yeah. So thanks. Well said. I mean, you know all about this, and I honour the work that you do at Access. I mean, I think there is a huge role for the sort of private capital that you were able to deploy and to leverage in from the wider private sector. And I mean, it's an old answer and one that's sort of gone out of fashion. But I think the way to invigorate the kind of commissioning we need is to focus on outcomes, and I think we need to revisit the whole agenda around outcomes commissioning, payment by results, we've learned a lot from the good and bad projects or the successful and unsuccessful projects that happened over the years in the coalition years. But the basic principle of de-risking the taxpayer by saying that government will only pay, or commissioners will only pay, on demonstration of outcomes that have been agreed at the outset, and that the risk is carried by private wealth in whatever form, is such an exceptionally good one. But not only because it takes the risk away from the taxpayer, but also because it induces the sort of behaviours and focus on success, which sadly lacking in the monolithic, old-fashioned model that Jerome was talking about. So I think we can and should, and if we're able to revive the spirit of public service reform that was so strong when we first came into power, I think that should be a big part of the answer. And Charlotte, you're absolutely right. I mean, the danger is we are talking about something very, very niche and marginal at this stage. I mean, by design, actually. And I think rather than trying a new kind of Andrew Landley, let's just transform the whole system from above, we actually need to own and sort of welcome the degree to which this is niche and bottom up and small scale, and it will acquire momentum if it works. And yes, there needs to be some big things I think government can do around procurement and commissioning, but we need to induce change in a sort of guerrilla fashion, I think, and enable communities to take control, and then we'll see the momentum build. But it is going to take the leadership from the top to protect these small scale experiments and innovations that are happening at a local level, because the whole spirit and ethos of the system will be to reject it and to talk about the risks and the waste and the duplication, of course, which is real. So I think it is a good legitimate challenge, and in a sense we just have to own the fact that it's marginal and protect it, and see what good can be done at a local level. Old tools won't work well. We've got to acknowledge that too.
Can I try and just add on that? Free schools are marginal. There are about 550 free schools. I think there are about 22,000 schools in the country. But their impact isn't just felt in the students who go to the free schools, but as a challenger, they brought ideas and they've affected the outputs in a positive way in many other schools which aren't free schools. But I think, yes, it starts off as niche, but if we start seeing pockets of demonstrable success, where rather like we have done in the last decade of the Wigan deal, then that will influence even parts of the monolith just as much as it is in the areas which have had the strength and ability to put their hands up and say, yeah, we volunteer to be guinea pigs and to spread the word.
I'd just say, Seb, as well, just to add, and if I may plug a different Demos paper today. We put out a briefing paper today suggesting a third stream of funding in the Treasury to focus on prevention as a kind of symbol of intent that would encourage kind of across the system for people to take prevention seriously. There's not loads of extra money, but if you experimented with that pot and proved the case that investing in communities can start to prevent problems longer term, and I'm going to ask Felix to put that paper on our Twitter account now, so people can see that.
Which is something we are pre-implementing your brilliant idea. In fact, I mean, so the Treasury's
already
the shared outcomes fund is very much about doing those preventive things. So, for example, it is funding what we were about to do with blood pressure and health checks in employers, right? A really preventative thing that's coming about. It's a share between us and DWP. So you are correct. We are trying to do it. It's a good idea.
And it's a good point, actually, because in the community covenants as well, we haven't talked about the role of employers and how important that is to get right and stitched in as part of the community. Do you want to pick that?
Yeah. Well, I think there is a big theme, and I mean that's the earliest paper in our series that we've done on this emphasises that, and actually I think they can play a big role potentially in commissioning services as well. I mean, thinking about when making all what we're discussing here practical. Again, Demos has done a lot of good work on this. Lloyd Mackenzie writing about the new model of public services, mutual welfare models, which again are the kind of root of our modern welfare state. I think have the opportunity to demonstrate the power of community-led policy, but businesses need to play a crucial role in that. So, essentially insurance against unemployment is something that could be organised at a local level with state support with a proper legal framework, with input from employers, and from trade unions, and from communities themselves, and obviously from individuals making a contribution. So the idea of actually investing against future shocks is the principle of mutuality that underpins the original national insurance out of which welfare grew. And I don't see why we can't revisit that and return to it probably on quite a local level. But it's going to require significant input.
Thank you. I'm going to take 2 more questions, David, and the lady at the back afterwards. So David first.
Thank you. So flashbacks actually from doing the study with the PM in that period where we were talking about the overlap between public service reform, pushing the camera, and some of these kind of agenda. One of the areas we were very towards health. Like actually one area we just can't be very excited about. But how would you mobilise? What in practical terms would it need to mobilise, particularly social networks through which we receive most of our support mutuality? So it would be, the London Patient Hotel. Instead of saying no to relatives, we should want them to come into hospital stay and not say, the visiting hours are the following, better than outcomes, lower costs, etc. Or in Wolverhampton, of course, food is that, it's really hard to change your diet when no one else in the household does. And we live in social networks. What does it look like? Or in school, we have a beautiful intervention around young people. Would you like to nominate 2 study supporters, kids who are famous? And there will be people who you can choose, but it will hassle you because the school will then send them information about what's going on. So you can have a different conversation with your 15-year-old instead of, what did you do at school today? Like, but you've got information. Are you reading this book? But the point about it was actually a really powerful agenda because the ecological role of these networks is very, very powerful. And is there a way of, intimate social networks somewhere we can mobilise them? Can we get the politics of that right? We struggled with that, nearly a decade ago. And Neil, sorry, a lot of this you went through are really, really interesting things that are worth doing. But for the most part, they were they weren't stepping into the sort of mobilising of the social networks. And why are we still so hesitant? Does that be forced? Of course, the point would be make it easy, design a system which is sort of realistic about that is how we live our lives.
Will you just introduce yourself? So your name.
Let's actually nudge you as was in the downstream.
Thank you very much. And we'll take this question at the back as well, and then you.
Hi, I'm Janine Hyatt. I'm from the Fair Education Alliance, or a cross-sector coalition tackling educational inequality. And I think more and more in the education sector, people are very aware that barriers to good educational outcomes for everyone lie outside the school gates, and that there'd be huge benefit to joining up locally delivered services more than they are now. We had a panel this morning with Sir Ian Duncan-Smith who said that he would love to join up services and as part of the idea behind family hubs and integrated care boards, but health is the barrier. That is very hard to get data sharing between health and other departments. So I guess my question is, how do we better join up all public services with the third sector, with community organizations, health, education, social care, housing, everything, so they can collaborate better, get better shared outcomes.
Brilliant question. Thank you so much. Do you want to start on those?
Yeah, excellent question. So I tried to lay out, David, a bit that there's a number of things going on in the philosophy of what we're doing in health, beyond just the important points that colleagues have been making about kind of the role of the social and the communitarian, as well as this point about empowering people and increasing accountability as well. I mean, we are obviously doing things that are deeply tapping into that kind of well of thought about there is such a thing as society. It's not just the same as the state. We have 3,000 people who are social prescribing link workers in GPs now, 3,000 people, and their job is to stop isolation, connect people to community. Every GP knows there's a lot of people there, primarily because they're lonely, but also just trying to socialize people again, connect them into their local civic society. So it's a big thing. Things like Start for Life and the 300 million program we have there are all about trying to help the most frayed bits of the social fabric. Absolutely. So we are doing things on that. It's one of the things that we are doing, but there is, of course, a lot more we could do. I'm very struck looking at my own constituency in Leicester, that we have a lot of multi-generational living, and that has unbelievably positive effects. People are looking after their parents at home. It's taking a huge burden off the state in terms of social care. is brilliant for the kids. It's one of the reasons why places like Leicester have high school achievement. The kids have got more adults at home. And it's fundamentally a good way of living. I go to people's houses, we have meal, grandma or granddad at the head of the table. It's a good thing. It's what we'd want for our relatives. And there's no real discussion about what we might do to encourage that, but perhaps there should be. We should think about some of these deep social things and to think big about them. And that's why I welcome this paper, is to renew that conversation about, like, let's get at the kind of the mouth of the river or the root of the tree, and like think about the things that are really downstream from all these social problems and drivers of public spending, to tackle the root causes of things and to understand them.
Well, what do you think would make anyone in government feel more comfortable with letting go and empowering communities more?
I'm not sure that it is a letting go conversation. It's not that that's what worries people. It's like you have to do big, heavy metal things if you want to make a difference. So in this checklist of things here, in this brilliant paper, things about, we should publish the family test. Now, we already published the family test in things that I sign off. There's a family test. It also says reversing the downward trend in investment in families, right? There's big things you can do, but it's a choice. You've got a choice between that fiscally and other things. There's lots of other priorities. And you've got to decide how much, the Chancellor, I think, quite right to choose investment in children in his recent budget. You could ask about, how we deliver that. But it's about thinking about, well, that has direct effects. It's good in terms of, helping people work and so on. But it also potentially has some indirect effects in terms of deeper social effects that it has. So I think it's the ever ongoing, never will go away debate about where we put our resources. That's the real choice here, and having the conversation is step one to potentially getting at some of those things.
Definitely. I think it comes back to Charlotte's very, very good point about how you get that change to happen. And I think, Juliet, you made the point around innovation as well. What would you say to urge that innovation to happen?
Well, I was actually thinking of one example where sometimes, at least the government could just sets up a scheme and then meddles so much that it doesn't work. And I'm thinking of a conversation I had recently with someone about natural England. And this is someone who owns some land and they want to make it economic. And one of the ways they want to do that is give offsetting biodiversity sort of credits to people. And they'll basically sell a bunch of units to people who are going to develop other areas. And okay, we're going to foster newts or nettles or whatever it is that Natural England has said will count and what they want. And then Natural England will call them up and say, have you thought about this wild orchid? And suddenly everything, because we're not going to okay any schemes unless they look at that. And suddenly, you had a whole area that was a sort of local, biodiversity sort of sphere that was developing a market, a community of people who were building something that then has to switch direction, and then nothing happens, and you don't get the policy you want. So I think, I think Danny's right that you basically need political leadership at the centre to say we're going to let lots of different things happen, and we're not going to fuss constantly with new things that we've set up or meddle all the time. We're going to sort of let different things happen and see where they go.
And I hope that new ideas start in rooms like this, in conversations like this, in partnerships like this. We're really grateful to NSCU for working with us on this and sharing a kind of thought process around this, to Local Trust for supporting this work, and to our fantastic panel for taking the time tonight to share their thoughts and ideas, and to you for coming.